A social economy, evolving, dynamic, changing into challenges, opportunities. And I'm sure that everyone here, through either their professional practice or personal experiences, has had roles or will have roles in this social economy. My journey started over 30 years ago as a psychiatric nurse, firstly involved in clinical and then non-clinical services, providing services in a metro environment and then moving to regional and rural environments. And then that evolved into managing teams to develop up programs that were offered at a regional and a sub-regional level. I moved then into working with communities around developing up programs in the disability sector. Again, as the social economy took hold of the change, there were opportunities for communities to feel empowered around developing up their own services. I came to RMIT 14 years ago, and I was very fortunate to be involved and lead a team of educators around our Department of Human Services Disability Workforce Program Review, which led to the development of a range of qualifications that started to open up ideas around minimum standards for a workforce in the disability sector. And then that has led me to my current role, which is the Associate Dean of Social Futures. We're delivering over 1.3 million hours of training to a sector that's very much engaged with the social economy. But through that excellent adventure I've had over the 30 years, the thing that really stands out for me, the thing that really excites me, is the engagement with you, the people that you meet. Those moments when, those chance moments when you're engaging in conversation around issues and you're working through potential solutions. That's the RMIT way. The conversation I want to have with you this morning is an example of such a chance meeting that actually turned into something really special. That members of my team involved with alcohol and other drugs education attended a forum not dissimilar to this, where they were engaging with a range of practitioners from the AOD sector, government, educators. And the topic was around how you form a community of practice approach to the ongoing challenges within community. At this forum, they met a coordinator. He's a coordinator in an Aboriginal health service in Katherine that services East Arnhem Land. And he's actually comes from a town called Nooka, which is about 350 kilometres east of Katherine. And he spoke about the beauty of the country. He spoke about the rich culture of the community and the connection between land and individuals, and it was a really powerful message. But then he also spoke about the challenges of the community, the issues around health and social determinants, whereas a community that we all expect positive health and well-being outcomes that this community are not achieving. Issues around heart disease, diabetes, tobacco-related illnesses, mental health, alcohol and other drugs. He, in attendance to this forum, was hoping that he could actually look at some engagement around skilling up a workforce, Aboriginal health workers, that could work within community people working within community. Because up until that point, there had been market failure. The only opportunities for learning, training and development was to take individuals out of the community and send them to Darwin, send them to Alice Springs, and then lay before them a national framework for a qualification that wasn't contextually correct for them. We promised we would get back to him. And we did. Working with David Hayward, who was the Dean of my school at the time, we evolved a front-end investment plan where we engaged the community on a number of occasions, talking with the board of governance to have a look at what the strategy of the organisation is, engaging the executive of the organisation to look how strategy evolves into operational contexts, and then engaging the HR systems of the organisation to start to build a capability map and how we, as a provider, could work with them to fulfil that capability map. But also I'm very fortunate, the great thing about RMIT is we also looked within the organisation to see what supports we could engage. Academic services, student support services, cultural support services, industry support services. So it became a collaboration within the university and supported at the highest level by our Vice-Chancellor, Martin. And we put the plan into place. This for me was a front-end view of what co-design is and should look like, working in a collaborative approach with an organisation. We started the training, a Certificate 4 in Alcohol and Harbour Drugs in Nooka, and a Diploma in Alcohol and Harbour Drugs and Mental Health in Katherine. And 9 months later, we had the graduations. And there was such a really unbelievable moment for our staff who'd put a lot of time into it, but most of all for the communities. In a place like Nooka, where, as I mentioned before, about 350 people, half the community came out to celebrate with the graduates. It was a big, big deal. And for our staff who travelled up on a monthly basis over those 9 months, not just to fly in and deliver workshops, but to travel up and spend time engaging in workshops, but also engaging in the community, working with these Aboriginal health workers within their environments. That was very powerful learning for our staff. I fast forward now to today, and our footprint in the Northern Territory has evolved, not just with this organisation, but with a range of organisations in Katherine, in Tennant Creek, in Alice Springs. We have formed a partnership with the Northern Territory Government. We're working in a collaborative way with Charles Darwin University and a broader sector. I'm pleased to be able to say that we have 200 graduates now across the Northern Territory into Certificate 4 and diploma level qualifications, working in frontline roles. I'm also pleased to say that that footprint evolved into having other ways and looking at other ways in working with organisations where we're working with Indigenous controlled organisations around governance, working with their executives around strategic planning, building micro-credentials, looking at skill sets. This October, led by our Deputy Vice-Chancellor, Belinda Tynan, we'll have our first alumni event in Alice Springs to send a message to our graduates that this is only just the start of the journey, let's keep moving forward. In closing, I'd just like to share with you that this is an example, just one example of the many examples that we at RMIT pride ourselves, are energised by the way in which we engage with community, industry. Our principles around ready for life and work for our students, industry connected, we hold dear. That we can say proudly that we are student-centred, we are staff-centred, and most of all, we are industry-focused. Thank you.